Tammy Baldwin of Wisconsin taking a break from Vote-A-Rama.
Senator Baldwin, are there any Republicans that are going to vote no this evening?
It remains to be seen, and if you can believe it, I believe they are still writing portions of this bill because they are discovering, based on the massive input from constituents across the country, that this bill is deeply unpopular. Turns out that people don't like bills that cut 17 million people off of their health care. And people don't like the idea of taking away food from 3 million people who rely on nutrition assistance, SNAP program funds. And people don't like the idea of adding $3.5 trillion more to our national debt. And so they are rewriting, it appears, portions of this bill to have the adequate number of votes to advance this. We, at this point, really don't even know what the final bill will look like. But in the meantime, in Vote-A-Rama, we are offering opportunity after opportunity for our Republican colleagues to make this bill better. And they are turning it down at every single option. And it's about who you're for. They would rather please Donald Trump than fight for their own constituents.
Senator, give us a couple examples of what the Democrats have put on the table. You were 20 votes in on the amendments out of 29 that have been proposed. What are some of the things that Democrats have been offering that Republicans have said, hell no, we don't want that?
Well, there's a whole range of issues. We're very concerned that the Medicaid cuts will cause rural hospital closures. So an amendment was brought forward to prevent that from happening. Republicans dismissed that. We have had an amendment to restore funding for Planned Parenthood, which is banned in this bill. And by the way, this isn't just about the issue of access to abortion care. Planned Parenthood provides a lot of preventative health care, birth control, cancer screenings, STI screenings, and in rural areas of our country, sometimes the Planned Parenthood clinic is the only option available for folks. And so we have offered those opportunities. We've offered nutrition assistance amendments, and we will continue as long as we can to fight on behalf of our constituents to improve this bill and make sure that Republicans are so aware of how unpopular the provisions in this bill are.
Senator, let me ask you about your colleague from Wisconsin, Senator Ron Johnson, who initially had come out against this. He didn't like the levels of spending. You've seen how the CBO has rated this. And then this today, after leading opposition to President Donald Trump's budget bill, Wisconsin senator says his switch came after, quote, commitment from the president to return federal spending to pre-pandemic levels. Do you buy that?
I do not buy it at all. And, my senior senator is one who has said this adds too much to the debt and the deficit. It's one of the flanks of the Republican Senate caucus that has expressed vocal opposition to this bill until this weekend. And we just see a new estimate that shows it adds much more to the debt and deficit than we previously thought, and certainly than the House-passed version. How are the Republicans trying to cover that up? Well, they're lying about it. They're using a baked what they call a baseline, a current policy baseline that obscures the major hit the deficit and debt are taking with this measure. In other words, it wasn't enough to pay for their tax cuts for the corporations and the ultra wealthy to cut people's Medicaid and cut people's Affordable Care Act access and cut people's SNAP benefits. They also borrow for this, and that indebts our future generations to pay for these tax cuts.